Hello. Hey, hi, it's Shelly. I am here. I just did Facebook Live. This is my first YouTube Live. So let's talk about why I'm here. I'm not anticipating I'm going to get a flood of people coming in here. So I'm just going to start talking and we it kind of like I did on Facebook. Now, I'm here to to you about telemedicine, telehealth when it's appropriate. If you have any questions regarding either, you can let me know. But it's essentially to um, educate people about telehealth and when it's appropriate to use and not. Okay. You see me adjusting myself. Making sure I look okay. I know you saw I need a little lotion on the elbows there, but that's okay. We're not here for beauty, right? We're here to learn. So, hi everyone. My name is Shelly. I'm a family nurse practitioner. Been a nurse for quite some time now. My specialty as a nurse practitioner is family medicine. I also, as a registered nurse, have an extensive background in women's health, and I've worked in labor and delivery for quite some time. So let's talk about telehealth and when it's appropriate, when it isn't. Telehealth is something that really gained popularity during the pandemic because people needed health care. There was no one to do it um, in person, or it was very risky to do it in person. Telehealth has been around for quite a while through telephone visits. That would still be considered some form of virtual health. The other form, of course, are video visits. And a lot of that actually really emerged during the pandemic because it was difficult for people to have access to care. After the pandemic, they realized that there is still some use for it in the medical sense, and so there was more reimbursement for it, and it is still here today. Now they've extended some reimbursement for it recently, and hopefully that will continue. But there are still platforms out there where you don't necessarily need health insurance to utilize telehealth. Um, One of the platforms I currently work through that provides minor health care, prescription refills. You can connect with mental health resources and other things. So, more of those are sure to emerge as we fully embrace technology in this day and age. So, one of the things that I did want to talk to you about is weight loss management. As you know, I'm on my handle, Girl versus Cupcake, and on this YouTube channel, I do talk about my own weight loss journey. And I did lose a significant amount of weight quite some time ago. I did not use any medication for mine, but that's not to say that it is not beneficial and that other people could find good results using it themselves. But that is one of the things that's available through the platform that I work through, namely the GLP-1 medications that have been getting a lot of publicity lately due to many athletes, entertainers that have used it successfully. So, when is it appropriate to use GLP-1s? They are currently FDA approved for people with a BMI of 27 or greater, plus another medical condition like diabetes, high blood pressure. These medical conditions are known to either be caused or can be corrected if a person loses weight, but they are closely associated with people who are overweight. And that is why they approve them for usage for people with a BMI 27 or greater, because theoretically, someone with a BMI of 27 isn't really that far off from the goal of 25 or less for weight loss. But if they have these other medical conditions, it may benefit them to utilize a medication to kind of help guide them and ensure they kind of get the weight off. The other instance is if your BMI is 30 or greater, you can automatically utilize, well, again, it's FDA approved to utilize these medications without having to have that comorbid condition. Now, most of the time, people who do have a BMI that elevated, they do have comorbid conditions, so they are double qualified to use it, I guess you can call it. The problem is these medications are super, super expensive, and most healthcare insurance won't cover them. So there are platforms like the one that I am currently working under called Sesame. I think there's one out there now. There's a few out there that can offset the cost, and they have their own programs to where you can connect with a licensed healthcare professional, and they can do lab work and other things that will help determine if you are eligible for it and kind of guide you through it. Are GLP-1s the only medications that can facilitate weight loss? No. There are some other pills that aren't in that medication class that you could potentially utilize for your weight loss efforts. The question with GLP-1s, if I start those, am I going to have to stay on them forever? Hopefully not. The jury is still out on that. The majority of people who lose weight using GLP-1s, unfortunately, will need to remain on it. To maintain their weight loss. There are some theories as to what can prevent that. There's still a lot of research out there to determine what you can do to decrease the possibility that you'll need them long term. My personal belief is that it's strongly associated with your diet, exercise, and muscle tone. Again, these things are still currently under research, and we'll know at some point in time. But my goal with my patients is to make sure we're establishing a good exercise regimen in addition to changing the way we eat and changing the way we think about food in general. The GLP-1 medications kind of work in that it decreases the appetite, and it kind of curbs some of that reliance on food for somebody who me, I'm a stress eater, Diary of a Mad Stress Eater, that's my blog handle. But they can help people focus more on eating for sustenance as opposed to eating for sport, right? That's how most of us end up gaining weight anyway, because food is good, and the GLP-1 can kind of help you forget momentarily how good food is, and helps you push away from the table. And you will have those days where you will eat things that might not be the best for you, but these medications can kind of help you put the brakes on how much of it you eat. Now let's talk a little more about telehealth in general, when it's appropriate, when it isn't. Um, Telehealth is not purely intended to completely replace hands-on medical care, but it's very instrumental for people who have limited access, limited resources for healthcare, but they do need some medical attention. So a provider like me could be there in the interim to kind of help you maintain your health until we can find a permanent solution to your health care. Can you utilize it, kind of, like hybrid? You go to your provider, and then for certain things, your, appointments would be via video or telephone, of course, right? And, that is what I anticipate in the future we'll see more of. But, depending on what the medical condition is, you may, of course, need a in-person visit. It's never good to utilize, quick services, urgent care services, or even, the telehealth services, um, just for your maintenance without having a regular provider. Are there some, regular providers who, you can obtain through telehealth services? There are, and it's emerging even more, and, platforms like the one that I use will probably really promote utilizing more remote services for healthcare. But again, it's always going to be best for you to have a hands-on provider and someone to physically see you, touch you, listen to you, definitely depending on your condition. The horizon is unfortunately leaning towards some more computerized medical options like AI chat bots who are programmed to listen to your symptoms and see if they can come up with a plan based on algorithms, right? Which, for the most part, many medical providers, we have guidelines, we have certain protocols that we do use that are standard. But of course, they need to be tailored to the individual. With AI, it may be difficult for the AI medical provider to tailor your healthcare to your individual needs because they don't have the deeper thought process of although they're working on that. So hopefully our future medical people won't be a whole platform of computerized me, so to speak, and we will find a healthy way to integrate both. But um, in the meantime, if you have like a really bad cold, flu, you need some medication to help you get over your cough, help you get over your sniffles, you can make a telehealth visit. They'll be able to determine if you need to get further care based on your symptoms, kind of seeing what's going on. Based on your age, or if you might have an infection, you need antibiotics. Urinary tract infections are another potential good telehealth option. Of course, they're going to talk about your symptoms. If there's anything that they think could be a little more advanced than a urinary tract infection, for sure, they will recommend that you get care. So it's all about balance and knowing when it's okay. If you're having severe chest pain or some extreme pain somewhere else in your body, go to the emergency room or call 911. You never want to wait around for anything like that. Those are definite reasons you need to go uh, to get advanced care for. Now, in that same arena, say that you're a diabetic and you've been unable to get your diabetes medications, and you may be able to visit with someone in telehealth just to help you out in the interim to prevent you from needing to go to the emergency room for complications related to your medical condition. So, you can pay $100 quick visit bill to avoid thousands of dollars later on down the line, especially for people who don't have medical insurance or no other option to pay for their care, right? So, what I'm hoping for in the future, at the current moment, I am doing some of the minor urgent care and the medical weight loss appointments through the platform Sesame. And I am also offering health and medical weight loss coaching. Not It does not necessarily involve the medications, but I do have my own website, sdafnp.com, where people can come for weight loss coaching, more so the nutritional component of it, and also for minor visits. And with through this platform, you may be able to establish a more regular form of medical care with me, in more of a concierge type, one-to-one, platform. So again, my goal is to ensure everybody receives medical care. When I went to school, I did complete a subspecialty in underserved populations, which the goal was to ensure everybody was able to obtain health care, if not through some of the major insurance plans, something that we call the safety net that's out there that we can refer people to. to find a medical provider and at least start to have regular medical care. A lot of these places work with sliding scale, or they're able to kind of help you get an insurance plan to maintain you. We know that at this point in time, a lot of healthcare is kind of up in the air. So we're hopefully going in a direction where we'll be able to find affordable plans for everybody. But in the interim, there are the platforms again like Sesame and others that can at least get you over the hump and prevent you from having some more severe health event before you could get regular care. Like, for example, you have high blood pressure, you're running out of your medication, you lost your insurance, but you still need that medication. There are people who can, at least help you maintain your prescription and keep you going for a good while or until you can at least get a regular healthcare provider, or one of those people could at some point become your regular healthcare provider, depending on what their availability is and what their goals are through telehealth. But again, this is something that's probably going to be a while around for a while, and a good option for people who need good medical care. Hopefully, I'm one of those providers who could be there for you. Speaking of which, let's talk a little bit more about providers like me and what that means. I am a family nurse practitioner, and that just means I'm a registered nurse who received extra training. For me, my specialty was family medicine. You have people who may get more focused training in a specialty like women's health or cardiovascular care. But these people do have advanced training. We can give you prescriptions and other things you may need, other medical devices, and help you coordinate your health care. There are also physician assistants or PAs. They are trained a little bit differently, but they also receive advanced medical training to help you in primary care and in other specialty areas as well. We're in a point in healthcare in our country where the people going into become medical doctors, it is decreasing, and so we need someone to fill in those gaps in the interim. And midwives, nurse practitioners, and physician assistants are equipped to do that. And the key is that we know when we need to send you out to a specialist, or if you need more advanced care, we can help coordinate that for you. At least we can get things going, get the ball going, find the problem if there is a more extensive problem, and then steer you in the right direction. Again, this care is your initiation into the health system, and it's better than you not having any care at all. The condition worsens, and now you're needing more extensive medical care to fix something that could have required less care if you had the right person to kind of help you out and coordinate your care. Our nurse practitioners and physician assistants or are they doctors? No, we are not doctors. We are people, again, who've received extensive training. We're considered in some arenas mid-level providers. So we're somewhere in between like a nurse and a doctor. We're mid-level. We're in between. So we can do a little bit more than than nurses, but we're not trained to the extent of a doctor who um can provide more advanced care. But there are things that we have the ability to do that are similar to what you would receive, like, say, for example, as a family practice doctor. There's a lot of things that we're trained to do, but they are still a higher level of training and care, and you may need to see a medically trained doctor for some of your healthcare needs, depending on what's going on with you. But um, again, we're here to make sure you have some care as opposed to no care at all. And I have a passion for the people, especially those who have difficulty financially to receive their medical care. I want to be that person to, if I can't personally do it, I can help you get it, right? And kind of get you started until we can get you a more stable, medical plan. Now, in the future, I'm hoping that at some point I can, have a brick and mortar and maybe some of the people that I reach through, my lives or other outreach, I can actually be their, primary care provider. But in the interim, I'm here. If you have any questions, you can, contact me. Uh, I hope that you can check out some of the videos that I have. I have my own weight loss story that is on this channel, Girl versus Cupcake. I also have my blog, Diary of a Mad Stress Eater, that I do need to update and maybe put some more entries in there. But it gives you an idea of what my story is and how I want to use my journey and what I went through to kind of help you. And I talk about some of my pitfalls, some of my nutritional vices, like I'm a stress eater. I'm stressed out. I tend to eat sweets, namely cupcakes, and that's why I have the handle Girl versus Cupcake. So, another thing I want to talk about through this and any future quote medical videos I talk about, YouTube or any other social media platform is not a source of medical care for you. And anything that I say is not designed to be your sole voice of medical care. You do need to see a personalized medical provider for your healthcare. This channel is not intended to provide your healthcare, but I am here to kind of help facilitate you into getting a regular healthcare provider. All right. And so for today, it's great. This is, my first live. I do have some other stuff on there. I firmly believe in laughter as a form of mental health and medicine, and I do have some other content that is more related to fun and laughter, and we'll probably be uploading some of that soon. But in the interim, when I'm not being silly or having staff meetings with my wigs, I am here to kind of help you out and help you for your medical needs. So again, if anybody has any questions, feel free to send me a message and I will point you in the right direction or answer it to help you out. Thank you for those who jumped on, and I hope to do more of these in the future. Bye.